so many women are put on birth control so young, and like that's their only option to preventing pregnancy. There's a lot wrong with what we are and are not taught with women and how women, you know, a lack of understanding of what's happening in our own body. Hello, everybody. Welcome back to another episode of She's in Sync. Today, I have a returning guest to the podcast, Vicky Chehade. And as a reminder, Vicky is a certified nutrition coach and fertility awareness method educator. She's based in New Jersey. And in her online nutrition and fam coaching practice, she helps women decode their menstrual cycles, balance their hormones, and optimize their fertility naturally. Through a combination of cycle charting, personalized nutrition strategies, and lifestyle support, she's helped dozens of women not only minimize frustrating period symptoms like PMS, painful cramps, and irregular cycles, but also successfully conceive naturally, even after years of struggling with infertility. Whether you're looking to gain better control over your hormone health or improve your chances of getting pregnant, Vicky's holistic science-backed approaches empower women to take charge of their fertility with confidence. So Vicky is going to come back on to specifically chat about what to expect from your period when you come off of birth control. And so the last episode we did together was very much focused on fertility awareness method and getting or preventing pregnancy. So today we're going to shift the script a little bit and talk specifically about what you should expect with your period when you come off birth control, because there's a lot of confusion, and I've even had a lot of clients coming up with questions, and I've been consulting with Vicky, and we'll talk about an exciting addition to my VIP coaching that Vicky is bringing to the table at the end. But there's a lot of like, is this normal? Is this supposed to be happening? Is this bad? Is this good? So we're going to dive into all of it, of what to expect with your period after stopping birth control. So Vicky, welcome back to the show.
Thanks for having me. I'm so excited to be back.
Let's start with, in terms of when you're stopping birth control, let's talk about what's going on with your hormones in general, because I think a lot of times people expect their body just to bounce back to what it was like on the birth control pill. And one differentiator, I always say this, so if you are a regular listener, you probably know, but for anyone new, just a reminder, you're not having a true period on birth control. So that's point number one of you're not ovulating because of your hormone cycles are not how they would be off of birth control. But a lot of people think like, oh, if I had my last period on the pill, for example, September 8th, when we're recording this, then I should expect October 8th, if you have a 28-day cycle, for my period to come then. But that's not going to be what we see for the most part. So let's start with like the basic foundations of what is happening to your hormones in your body once you stop hormonal birth control, especially if you've been on it for, 10 plus years, like the majority of my clients have been.
Sure. So I'm going to start by answering this question with, it's going to depend on the type of birth control you were on, right? So if you were on like your traditional combined birth control pill, that's one thing. If you had a hormonal IUD, that's one thing. If you had a copper IUD, that's another thing, right? So I can really break it down and get into the nuances if we want to, but let's just kind of pretend that you have been taking the combined birth control pill for 10 plus years, right? Basically, when you are on a birth control pill, it is flatlining your hormones. So the brain and the ovaries, when you're not on any kind of birth control, there's this constant back and forth conversation happening. And that's going to lead to this really cool symphony of hormonal fluctuations throughout your menstrual cycle. But when you're on birth control, that conversation between your brain and your ovaries is completely shut down. So we're not getting any kind of follicle stimulation. We're not getting any increased estrogen. We're not ovulating. We're not making progesterone. Like all of that stuff is not happening. So if you think about it, if you've been on a birth control pill for 10 years and all of that communication is shut off, things are not going to come back online very quickly and very smoothly. So I always like to explain it as your brain and your ovaries, they're kind of dating again, right? Like we need to slowly start that conversation. So you can't really expect a textbook 28-day cycle to just happen when you come off of birth control. It's going to take time.
And what about with the copper IUD is its own category because that one is not hormonally based. So that one, typically you should expect a similar cycle because you are cycling on hormonal birth control. So that is a pro of that. I will say a caveat is it is something artificial in your body. So you just want to be careful and make sure, especially, one thing I do with women is testing their copper levels because if they are putting copper in their body, they're already high in copper, which is common with post birth control syndrome or after being on the pill for a period of time because of estrogen and copper's relationship, that can cause copper toxicity, which can lead to a whole host of symptoms, most notably painful, heavy cramping in periods, mood, anxiety issues, fatigue, etc. But in terms of period, that one is most natural, I will say, because you are cycling, you are ovulating on it.
Yes.
If you are, in fact, confirming that you're ovulating. So, what about the hormonal IUD?
Yeah, so the hormonal IUD is a little bit different because that is not a combination of synthetic estrogen and synthetic progesterone. It's just a synthetic progesterone. So that only in like 50% of users, they'll still ovulate on a hormonal IUD. So what that's actually doing is it's really just impacting your cervical mucus and it's thickening cervical mucus so that sperm can never get through. It's also thinning out the uterine lining a little bit, which is why so many women on a hormonal IUD usually don't end up getting a period, or they'll just have some like random spotting. But you can technically still ovulate. So I do find that women, when they get their IUD out, those cycles return a little bit quicker as well.
Yeah. And that's interesting because that goes back to, I know a big thing that you teach in your FAM course is, tracking cervical mucus. And so if you're on the IUD, even if you are ovulating, you still, correct me if I'm wrong, but it sounds like you can't really still track signs of
Yeah.
ovulation as well because your cervical mucus is not as accurate.
Correct. Yep, exactly. Yeah. It's
Okay.
I've had women start to learn FAM while they still have an IUD in, and it's like we can see some little things, right? But it's definitely not going to be the same as when you get that IUD out and your hormones are allowed to start doing their full thing again, which is
Mhm.
going to have that impact on cervical mucus and make that cervical mucus more accurate to be able to track.
So, with just as a recap, with the copper IUD, if you get that removed, you can pretty much expect for it to be about the same cycle
Mhm.
length and timing. If you are on and getting off the combined birth control pill, that one is probably going to be the messiest one and less reliable one. You're just going to have to give it time to regulate your own hormones because both your estrogen and progesterone have been impacted. If you are on the hormonal IUD, that one's kind of in between those two, where it's, it might come back quicker, might be more of a regular cycle faster, but there's still going to be maybe some bumps in the road and some trial and error as your hormones regulate themselves.
Yes. And I want to say two things in response to that. The first is obviously there's so many nuances to all of this because yes, there's the synthetic hormone piece that is impacting your body's ability to ovulate. But then we have to look at those regular factors of life, right? How's your nutrition? How's your stress? All of that's going to impact how quickly your return to fertility and your return to ovulation is going to happen. Um, and then the other thing I do just want to mention is if you are someone who had the Depo-Provera shot, that is going to be the longest return to fertility. There have been studies where it can take up to 18 months for ovulatory activity to really come back. So for women who are looking to get off birth control and maybe want to start getting pregnant, right? Family planning, just know that the Depo-Provera is going to be your longest time to return.
Interesting. Do you know why that is?
Not necessarily. I think it's just the mechanism, it's the dosage of the synthetic estrogen that is in the Depo-Provera shot has something to do with it.
Okay, interesting. Yeah, I did not know that. So that's really good to know. Cause yeah, there's like the shots too. And do you know anything about the arm implants?
Yeah, that one isn't, that's probably like the same. level as like the combined birth control pill.
Okay.
Yeah.
Okay. Yeah, so many varieties now to to think about.
Yeah.
Okay, so let's keep going down the track with the pill because I feel like that is the most common one that women are on, and like again, maybe the one that besides the Depo-Provera like is going to be the longest to come back. So when you're talking with women about, stopping birth control, what is there an average length of time that they should expect to get a period back? Let's say their foundations, let's go with the woman whose foundations are really good. Like she's eating enough, she's, maybe she's worked with someone like me where she did prep her body to have a smooth transition off birth control. What should she expect? And we know this is going to vary person to person, but from your experience in working with so many women.
Yeah, and what I'm taught through my fem training is we're taught to say expect 6 to 7 cycles. So for some women, that might be 6 or 7 months if you do kind of get a pretty regular period when it comes back, but that can be up to a year, right? If you come off the birth control pill and your cycles are pretty irregular in the beginning, maybe you're not getting a period for like 50, 60 days. That's going to bump out that timeline for that total of 6 to 7 cycles.
That's a long time.
Yes, it is.
So,
Yeah.
how do you, when someone stops in terms of like learning fertility awareness method, how do you coach someone with that if they aren't getting regular cycle right away?
Yeah. So that's the beauty of FAM and learning a method like this. It doesn't matter if you have a regular cycle or an irregular cycle, your body is still going to be showing you signs as to when you might be fertile, is your body attempting to be fertile, and all of that. And so in my method, we use cervical mucus and we use at home LH testing. And so LH is luteinizing hormone, that's the hormone that triggers ovulation. There are, test strips that you get, and they're urine test strips. So the combination of the cervical mucus with the LH testing gives us a really accurate read as to when your body is fertile. So in a woman coming off of birth control, what might end up happening is she might go from having dry sensation, which is infertile, right? No cervical mucus, dry sensation, to she might have like a day or two of fertile cervical mucus. And then it goes back down to dry. And then maybe like a week later, she has a couple more days of fertile cervical mucus. And then it goes back to dry. And so how I like to explain that is that's your body's attempt at ovulating. And so that's what can lead to this more irregular cycle, is that the hormones are almost starting and stopping. They're not getting to the levels that they need to in order for ovulation to occur around cycle day 14, and then for you to have a 11 to 16 day luteal phase and then get your period. But that's the beauty of tracking, is once you know how to identify what's fertile, what's not, you can start to see these patterns over time.
Okay. And so, in terms of like if you want to conceive or if you don't want to conceive, when you're in that waiting period, let's say of like 6 months post pill, knowing when to have sex or protected sex, is it a lot more variable versus, typically when it's consistent, it's like, around that 14 to 16 day, for example?
Yeah. So my method, there are rules and there are different levels of rules. So like level 1 is for the person who is just starting to learn FAM. It is recommended that you have no unprotected intercourse at all. Honestly, it's also recommended that you don't have any intercourse, right? Because
If you don't
even
want to get
using a
pregnant, yeah.
condom, and even using a condom, like that makes it a whole lot harder for you to understand your own body's observations. So I often recommend to the women I'm working with, for the first month, don't have any sex. Like you could do other things, right? But don't have any intercourse. Just learn your body's own signs. As you start to get a little bit more familiar with things, level 2, there are rules about what days are safe to have unprotected sex and what days are not safe. And it has nothing to do with timing. So there are no like, you're always safe on day 20 every single month. It always depends on what your body's cervical mucus is showing you. And the reason for that is because ovulation is variable. Sometimes it might happen for you on cycle day 14. Maybe you were sick, maybe you were stressed, and then the next month it happens for you on cycle day 20. So that's why really learning those cervical mucus patterns is so crucial, because in real time, you'll know, is it a safe day for me, or is it a day where I need to use protection, or a day where I need to avoid intercourse?
Yeah, and that's a good call out too, with even when your cycle does become regular and you're having a reliable ovulatory period, it when you're ovulating could be different every single month, regardless, because of stress, because of, life situations, traveling, all that kind of stuff. So this is a good call out to really start tracking these things from the get-go when you stop birth control, because it's going to be something you should continuously be tracking, which is very different. Like, this is a big learning curve. So maybe we can talk about this next. Is these are things, and I said this before we hopped on, I was like, because I'm going through Vicky's course right now, and these are things like we should have been taught when we were teenagers, like in health class, versus like never have sex, you're going to get pregnant always. We should have been taught all of these things about how to track ovulation and how to track our cycles and when to know if you're ovulating, when to have sex or when not to have sex. Like, taking sex and pregnancy, teen pregnancy out off the table, like that's not what we're talking about, but just learning your own body, versus so many women are put on birth control so young, and like that's their only option to preventing pregnancy. And then doctors oftentimes will say, I know this was my case and a lot of cases with the women I worked with, of like, well, just stay on it till you want to become pregnant. And then women have these false beliefs of like, okay, once I stop, then it's just easy peasy from there. But so many women struggle with infertility, difficulty conceiving, and that's a whole nother topic for a different day. But there's a lot wrong with what we are and are not taught with women because, and I know that's why you and I both opened our own businesses, because we saw that gap in care and a lack of understanding in how women, you know, a lack of understanding of what's happening in our own body.
Yeah, I always say, like, imagine how good at this we would be if we started learning this as teenagers.
Yeah.
Like, most women I end up working with, like, some come to me in their 20s and I'm like, oh, that's amazing. Like, I'm catching you very early. But the majority
Yeah.
of women I'm working with are in their 30s. I've even worked with some women in their 40s who are just coming off of birth control for the first time. And they're like, what the heck? I'm getting like towards the end of my fertile life, right? Because we have to think about perimenopause down the line. They're like, I'm getting to the end of my fertile life and I'm just now learning this. And it is a shame, but hopefully these conversations are going to be big light bulb moments for a lot of women, and that can start to change the conversation.
I feel like your daughter's gonna, you have a little daughter, and I'm sure she's gonna know all this stuff like right when she needs to, which is awesome.
Oh yeah.
So, okay, I went off on a tangent there, but essentially bringing it back to my point of it's like learning a new language, essentially. And like you just said, I think of it as like if you learn a new language when you're really young, like we all know it's easier to learn a new language when you're younger versus when you're older. So it is a whole different way of looking at your body. It's at the beginning, I feel like it's harder work, right? It's like learning how to ride a bike. You have to consciously think about it. It's another layer to your day. So let's talk a little bit about how do you coach clients through that, when also like the sex piece of I've had clients who they're like this is hard when yes, you can't have sex for recommended 30 days post pill or, post birth control, just to be extra safe if you don't want to get pregnant, and figuring out other ways to connect with your partner, as well as just there could be that 6 months where it's not as streamlined, or you're kind of figuring things out still, and so having sex is different
Yeah.
than it used to be, where you could kind of do it whenever you wanted to.
Yeah. And it's funny. That's a conversation I've had with a couple of women who were like, we're just not a condom couple. And I'm like, okay, well then, everyone is entitled to make their own family planning decisions, but it's my job to let you know the risks, right? To give you all of that information so that you can really have informed consent over the choices you're going to make. But how I coach women through this is once you really start to like learn the ins and outs, the most important first foundation we always start with is just learning the different sensations of the different types of cervical mucus. And it's that practice of every time you go to the bathroom, just taking that extra second to think and say, what did this feel like when I wiped with toilet paper? Look at the toilet paper. Was there anything that you noticed? And that does take time, but it's just like any other kind of habit practice, right? You do something for 21 days and then it starts to become routine. So that does come fairly quickly. Obviously, the timeline can be shortened when you work with an instructor who can kind of be there and truly guide you through what you're seeing, what you're feeling, all of that. But the other thing too to think about is if you were someone taking the birth control pill, you had to think about that too, right? You had to think every day at 8 a.m., I'm going to take my birth control. So it's the
Right.
same
Yeah.
concept, right? Like each of these types of birth control has a thought process behind it. One is just you're observing your own body a couple times a day and seeing what you notice. The other is remembering to take a pill at a certain time.
Hmm. Yeah, that's a really good point. It's just a different thing that you're remembering to do. And, I'm a big fan of like visual reminders too. So I know there's an app that you recommend in your course. What's it called? It's on my phone now. I downloaded it.
So there's two. So you could use the FEM app, which is going to be free, and that will send you a reminder every night, which is cool. And then there's an app called Read Your Body, which is another option. That does not have the like notification reminder along with it. So if you are someone who wants the notification, I would say start with the FEM app.
Yeah. Or even, I know for me, like I get so many notifications on my phone. So for me, it's like I'm almost visualizing like at the start of doing this, like I've been doing this for a long time, but when I first started, I think what would have been helpful for me to get in the habit is almost like putting a sticky note like by my toilet or like by the toilet paper or something, just like a visual to remind me, because then eventually you'll get in the habit. I mean, it's just like I talk with my clients with eating. If they're not used to, if they're used to plowing through the day and skipping lunch, reminders in your phone, like in your calendar, like blocking off time, like whatever it makes sense to you to get in that habit and to remind yourself, do that right now. And then you don't always have to keep that sticky note by your toilet paper or that reminder in your phone, but just to your brain isn't used to that. And so whatever helps you be more consistent with it. And also, I'm imagining you are the same, but like you're learning something new, give yourself grace and don't expect it to be perfect right away. If you miss a day, just be like, okay, like that's fine. See if there's any gaps and where you can, make it more consistent moving forward, or just be like, that was an off day and moving on. Like today is a new day and let's just keep going.
Absolutely. And the nice thing too about that is like, let's say you had a crazy hectic day, you didn't really, have a second to like think when you sat down to go to the bathroom. Just treat it as a super fertile day and just say like, okay, we're not going to have any unprotected sex today because I don't know. And I'm going to elevate this to a potentially fertile day. And that's the nice thing about this method, right? Is like, you can just be like, okay, this is an off limits day because I don't know. So I
Yeah.
think that takes the pressure off of it too.
Yeah. And then going back to connecting with your partner or like just changes in sex, especially during this like intermediate point in time. I think a lot of women that I've talked to recently, there's almost like a grieving process of like, this is a lot of information. They feel a lot of pressure to learn it right away, to almost like, not just for themselves, but like to make for sure it doesn't impact their relationship. And so I think I just talked with a therapist last week, and so her show is going to be coming on too. And we talked about how to have a conversation with your partner when you make the decision you want to stop birth control. And one of her big recommendations was to make it collaborative because, yes, it's your body. And unfortunately, fortunately, however you want to look at it, it is a collaborative decision in terms of like pregnancy prevention or conceiving. So depending on which direction you want to go, I think either way, like involving your partner and letting them know ahead of time of, hey, my body is going to need time to regulate. Here's the approximate timeline that we can expect. This is how things are going to change in the interim. And so you're bringing them on to collaborate versus, I think as women, I know I do this. I kind of like hold it all in of like, okay, I'm learning all this stuff and I'm doing all these things. It's my body. And then I like don't bring my partner in as much, but making it more collaborative and letting them know. So that way there's not resentment or, he's in the dark. And so then when he's like, well, like if he's initiating sex, for example, and you're like, no, I can't. And then he's just learning that for the first time versus you've been prepping for this for, a couple months.
For sure. And I say this to all of my clients, like, have your partners watch the videos. Like, I've literally had multiple clients be like, yeah, I have to show them the videos on cervical mucus because they don't really understand. And I'm like, of course they don't understand.
Yeah.
Like,
We didn't,
we're
we
not
didn't
even taught
understand this
this.
until recently, right? Yeah.
Exactly. We're not even taught this. So I think that's so helpful, is educating them as well. And this is like a funny little tidbit, right? But people learn best by teaching themselves. So that's something you can do too, is once you've learned the information for yourself, teach it to your partner and say, hey, this is what this type of cervical mucus means. This is what that type of cervical mucus means. Hey, today I'm noticing this. So that means we can or we can't. And so the more you can then explain it to them, you're going to learn it better. They're also going to understand it, and you're having that great dialogue with them.
Yeah. Yeah. And I think finding other ways to connect with your partner in this time is important versus if it was just physical intimacy before, finding other ways. This could be a good challenge for you guys of finding other ways to connect during this time that isn't intercourse. So, yeah. And bringing them into that of like, how else can we connect? And this might be a good time to take the love languages quiz, each of you, to figure out like what is your love language, and if it's physical touch, then cuddling, things like that. Uh,
There's tons
yeah.
of other ways to be intimate. So
Yes. Yes. Um, is there anything else you would say in terms of when you're coming off, in terms of expectations, what's normal, what's not? Piece of advice for women?
yeah, contrary to what you might think, it is normal if things are a little bit irregular in the beginning. So I've had, women who have been on the birth control pill for years. They have that 28-day cycle in mind, and they come off, and all of a sudden it's 40 days, 50 days, 60 days, and they haven't had a period yet, and they panic. And so my first question is always, well, is there a chance you're pregnant, right? Like, did you do anything that there could be a chance, right? So that's always question number one. If they're like, nope, there's no chance of that, then I say, okay, then this is just your body starting to regulate, and we really have to lean into the signs that your body was showing you. So just my biggest piece of advice is like, give yourself grace in the beginning. That textbook 28-day cycle, forget about it. Like, it might come back, but it might not, and that's okay. There's a range of normal, right? Like 24 to 36 days is what I always say as far as like the normal cycle length. That's a whole lot different than just 28 days. The other thing I say as the first piece of advice is observe and don't judge. So in the beginning, and in my course and in my teachings, I'm always showing like, this is what a textbook cycle should look like. You have a couple days of bleeding, then you have a couple days of dry infertile days, then you have a 5 to 6 day fertile window, and then you have a 11-day luteal phase. So sometimes they get that in their head and they're like, but my cycle doesn't look like that. And so I'm always having to say, just observe. Right now, we are just gathering data. You are just learning the method. You're learning your body, and we'll get you to that point where things are more normal. It just might take some time.
Yeah. Yeah. And I think a world where, especially I'm thinking of my clients, like they've already been working with me for 3 to 4 months when we come off birth control. And so they just want they're so anticipatory and they want their cycle to come back, and they're also usually perfectionists, right? Type A individuals, and they want it just to be back and to be consistent and to be in control of that because they felt so out of control with their body, with their cycle for so long. So I think also, yeah, like the observe, don't judge, and also be patient with your body, trust that it knows what it's doing, patient with yourself, like really working on your nervous system, because that also, if you're stressing yourself out about your period being irregular, that's not going to do you any favors.
Exactly. Yeah. I put a post out a couple years, probably last year or the year before, of just that, like, birth control is a masculine habit, right? it's control, it's textbook, it's you take a pill every day and then on your 28th day, you'll start bleeding. But our feminine cycles don't actually work that way, right? So the feminine side of things is that you have to just flow with it. You have to just trust the process. You have to just release a little bit. And that's definitely something that is tricky, especially for those women who are more type A and are used to, well, I can expect my period on this day. We have to kind of release that a little bit.
Yep. Yeah. And if you were exactly, if you were, you knew when to have it, even though it's not a true cycle, it was that almost confirmation of this is working. So let's talk about poor foundations because I want to make for sure I see a lot of women with hypothalamic amenorrhea where they were put on birth control to regulate their cycle. So when they come off, it's no surprise that they do not have a regular cycle. And this is a big pro of doing FAM because you can start tracking your temperature. You are not going to have a rise in temperature if you're not ovulating, and you can start tracking your cervical mucus. Usually, people with HA, it's going to be pretty dry down there. Um, so, this is, I guess, another layer to consider if you were put on birth control for a missing period. It wasn't solving the actual true root of why your period was missing to begin with. So we want to be really careful when we're differentiating this of one, ideally tracking your temp, your cervical mucus, because that can give you clues. And if you weren't having a period before and you didn't get support for the root cause of that, whether it was under eating, stress, overexercise, etc., disordered eating, then you probably shouldn't expect your period to come back unless you did get support for those things.
Yeah, and the same thing can be said about PCOS, right?
Mhm.
That's another one where put on birth control to regulate their cycle. I was air quoting. Sorry, I forgot this was a podcast.
Yeah. We
Um,
all were air quoting. Yeah.
but those two examples, yeah, from a fam standpoint, what's interesting is like your hypothalamic amenorrhea women, they probably won't notice a whole lot of fluctuations to cervical mucus. Like you said, it will be mostly dry, maybe a few patchy cervical mucus, fertile cervical mucus sections, and then eventually they might get a withdrawal bleed, but maybe not. PCOS, on the other side of things, that they can actually have days and days and days of fertile cervical mucus, and that's from the like consistent low level fluctuations of estrogen that women can have with PCOS. So those actually are two red flags that I would say maybe we don't wait the 6-7 cycles. Maybe they do need more support sooner, whether that's medical management, whether that's working with someone like you. But I would still say give it 3. Try to give it like 3 months or 3 cycles to see if things regulate, and then obviously if they don't, to seek further support there.
Yeah. Yeah. And if you were put on birth control for PCOS or HA, then that's probably just something getting support before transitioning off birth control, ideally, or once you've stopped, just to monitor that because those both are complex conditions that you want someone who is skilled in that to give you that root cause care and support so that your cycle, you don't have to rely on birth control for that because it's not doing you any favors. It's masking the deeper root
Yeah,
issues.
1,000%. And this is a question that comes up a lot, so I'm just going to address it. You still can use FAM with PCOS. Like I have a client who she does have a lot of patches of fertile cervical mucus, not a whole lot of dry days, but we are still able to pinpoint her true peak day, and we are still able to get a luteal phase so we know when her period is coming. It's a little bit trickier, and that is something where you probably do want to work one-on-one with a FAM instructor to really get that specific nuanced guidance, but it absolutely is possible.
Okay, perfect. Yeah, and going further with that, like you can get pregnant naturally with PCOS, with endometriosis. There's unfortunately so much language of this is going to be super hard for you or this isn't going to be possible for you. And that's just not true. So let's just like debunk that right then and there. Again, getting support from people like Vicky and I to address the root causes, whatever is happening internally, and then being able to track your normal cycle or your natural cycle rather to identify when it's the best time to conceive.
Absolutely. Yeah. And one thing I do want to add to, we haven't talked about it yet, but you mentioned temperature. I personally do not recommend BBT as like your first stop on the post-birth control train. And I'll tell you why. Because if you are using something like natural cycles, or if you're trying to lean into just tracking your basal body temperature, that's only going to tell you after the fact. But because cycles can be irregular coming off of birth control, and you're gonna have maybe a couple patches of fertile cervical mucus, you don't know which one of those patches is the actual ovulation until after the fact. So just relying on a temperature-based method is really very risky, in my opinion, whereas you're better off using a combined approach of understanding the cervical mucus, what's fertile, what's not, and then correlating it with your temperature piece.
Okay, so you're saying not to use it by itself. And I've heard that. I think we talked about that in the other episode of like not using just temperature ever, like using that in combination with cervical mucus.
Absolutely.
Okay. And do not just use an app to tell you when you're having a period or when you're ovulating, because that is not accurate. It's just an algorithm. Like it's not actually when you're going to ovulate. So this is why this is so important. I can't tell you how many people they're like, I ask them, I'm like, how are you going to prevent pregnancy, or, know when to have sex to try and conceive once you're off birth control. And a lot of women are like, oh, well, I downloaded this app and it just tells me. I'm like, oh, let's
No.
talk about this because that is not going to, it's not based on your own body sign. So really the take home is monitoring cervical mucus first and foremost, and then you can layer in that temperature additionally to it. But really, if you were to track just one thing, cervical mucus is where I'm hearing, like, especially those first 6 months is most important.
Yeah, definitely. And then, like I said, I personally like layering in the LH testing too, which, like I said, I teach in
Yeah.
my method, because that really does help us pinpoint the true fertile window.
Yeah. Yeah. Because your rise in temperature is going to be right before ovulation, and then it's going to stay elevated. No.
It only happens after ovulation.
Okay. So that confirms you have ovulated because it goes up
Yes.
right after you've ovulated.
Yep. Because
Yeah.
progesterone is that heat-inducing hormone, and we only make progesterone after we've ovulated.
Yep. And then it will stay elevated like until your
Yep.
period comes. Yep. Okay.
Exactly.
Perfect.
Yep.
Perfect. So yeah, lots of things to remember and to learn. And that's why, Vicky teaches these things in her course and with her one-on-one coaching. And so it's a whole new language. And so going back to give yourself grace as you're learning this, because we, should have been taught these things and we weren't. And it's just a lot of learning and a lot of different stuff that you're tracking and you're monitoring than before, but then it becomes easier over time and more consistent over time too.
Absolutely.
Is there anything else before we, kind of close out and talk about your course and how I'm starting to implement that in my programs? Anything else in this conversation that you want to make sure we talk about?
I think the biggest thing is just you have to have a plan. If you are choosing to come off of birth control, you really can't wing it. I have heard stories of women who were like, yeah, I'm just going to try things on my own. And by try things on their own, that means like watching TikToks and reels of people talking about this stuff, which is not the same, and getting pregnant, right? And then that obviously leads to, a whole host of decisions that you have to make. So you have to have a plan. Whether that plan is that you are just going to rely on barrier methods, condoms, diaphragms, cervical caps, right? Like there are options as far as barrier methods go, whether that's learning a fertility awareness method, yeah, or whether that's male, getting your partner's getting a vasectomy, right? But there has to be a plan for you in place when you do come off birth control if you're
Yep.
not trying to get pregnant.
Yeah. Yeah. And even when you are trying to get pregnant too, like this is still a good thing to be talking with your partner about and learning these things. Of course, I mean, obviously that's a whole we focus more on like preventing pregnancy, but this also is very much geared towards women who wants to get pregnant too, of like learning if your cycle is doing what it should, if it's optimized, if it's healthy. Like your period is your fifth vital sign. Like it's so, so important. It's your monthly report card. We say that all the time. So a huge pro of the fertility awareness method is it allows you to become more in tune with your body. because as Vicky noted earlier, when you've been on birth control for so long, it was just something that was shut down. You weren't able to monitor how is your health doing. And it's masking the deeper root issues if you were put on birth control for something other than pregnancy prevention, whether it's acne, painful missing periods, PMS, etc. And so when you come off, hopefully you've worked with someone like me to prep your body for that transition, and then working with someone like Vicky to really make for sure your cycle is optimized, in terms of ovulating if you want to get pregnant versus well, just stop birth control and start trying and come back if it's not working, which is typically what doctors will say, which leads a lot of women struggling with fertility, being given no other option besides IVF, which, there's lots of things you can try before that. There's other, natural solutions we can come up with. Not that there's anything wrong with that, but there's so much misconception about birth control and stopping and periods. It's truly sad. It leaves so many women like suffering, whether they want to prevent pregnancy or whether they want to get pregnant.
Oh yeah, it's so true. There's a stat that I think literally 50% of couples are timing sex completely wrong when they're trying to get
Mm,
pregnant. And it's just like, come on.
yeah. Yeah, it's like once it's pretty easy. If you if your body is functioning properly and you're healthy and you know the timing, it's but it seems like this big mystery for a lot of people because of lack of information.
Exactly. And I say this whether you're trying to get pregnant or whether you're not, just the understanding your health and being able to spot your own red flags in your cycle is invaluable, right? Like you don't need to get hormone testing right away when you learn FAM because you'll be able to tell, is my bleeding showing me that I have healthy hormone parameters? Is my fertile window showing me that I have healthy hormone parameters? Is my luteal phase? So basically every phase of the cycle you'll know if your hormones are really doing what they're supposed to be doing, or if you do need to seek further support.
Yep, yeah, totally. Exactly. So all that being said, we talked a lot about a lot of things. And we really dug into how the fertility awareness method is so, so helpful when you're coming off of birth control, whether you want to get pregnant, prevent pregnancy, and just learning about your cycle and whether or not your hormones are optimized, if your health is optimized. And so, an exciting announcement is that I've started incorporating Vicky's FAM course into VIP one on one coaching. So, you'll get access to that forever, and she's continuously adding to it, and so it'll be, ever added to. You'll have access to the latest version of it, but it's so, so helpful. I started going through it this past weekend, and even I'm learning so much about cycles that throughout my own, self-taught learning about cycles and hormones and stuff I didn't even know. So it's going to be such a valuable resource for those of you who work together, because we'll be doing the prep work of coming off birth control, but then this is really like the icing on the cake of what to expect afterward and how to track your cycle and really feel in control. So it's the perfect complement to my program, and I'm really, really excited to offer that now, again, at no additional cost for those of you who sign up. So I mean, I gave a little overview of it, but you are the creator of the course. So if you had to kind of say in a nutshell, all the benefits in the course and what you learn, what would you say?
Sure. Yeah, I designed this course to really take a person through. I like to do it as like a 5 month journey. You could binge it and you could go through it quicker if you want to, but as we said earlier, FAM is really a learning process. It's a lot of new vocab, it's a lot of new things, and you need to give your body time. So, what's kind of cool about this is if you come off of birth control, and I said it takes 6 to 7 cycles to regulate, it's like, cool, you're gonna be learning this through 5 menstrual cycles, right? Step by step. I also designed this course to really be very layered. So in the beginning, we're starting with just the basics. How do you actually properly track your bleeding? How do you actually track your cervical mucus? Then we move into, well, what's the fertile window? How do you identify when it starts? How do you identify when it ends? How do you confirm ovulation? Then we move into, well, what happens if things are irregular and what can actually throw off a cycle? Then you learn the rules of what are your safe days for unprotected sex versus when you shouldn't. And then finally, we put it all together, and the final module is what I call living cyclically, and how to start applying this to your own life with your energy levels and little light nutrition and exercise and things like that. So it really is meant to take you through that journey. And by the time you finish, your cycle should hopefully be getting back to a nice regular place.
Well, thank you so much. And to wrap up, let's talk about how you are. I asked you this before, but I'll ask you again. How are you nourishing yourself in this season, this week, today, whatever?
Yes, I love this question. So we are in my favorite season of the year. I love fall, and it's just like so nice and cool and crisp outside today. So after we hop off this podcast, I'm going for a nice little outside walk to kind of just refresh, get some steps, get some sunlight, and that's a big thing I'm trying to focus on right now.
Being outside more. Yeah, I will say I'm a summer gal, so I'm it's bittersweet for the colder weather to come, but I do appreciate the brisk mornings and pumpkin spice and some of the things that come with it. So I'm trying to embrace it as well.
Year though, where it's like the blend of both, right? It's like cool in the
Yeah,
morning, but summer in the afternoon. So
that's true. Yeah, it's gonna be like it was 40s this morning in Ohio, and and then it's gonna be like 75 and like 80 later this week. So it's the
there you
confusing
go.
part where you wear different clothes throughout the day.
Yeah.
Awesome. Well, thank you again for being on. And for those of you who liked the show, please share it, leave a review. I'm sure so many women need this information just as much as you listening. And until next time, stay nourished.